As an ophthalmologist, I evaluate a number of patients for diabetes and diabetic retinopathy. I find that many people are extremely confused by this process and do not understand the risk factors for diabetic retinopathy. One of the questions I inevitably ask patients with diabetes is about their hemoglobin A1C. Now, there's nothing magical to the hemoglobin A1C number. It's merely an average of the blood sugars over the last several months. Essentially, the test looks for the sugar coating on the red blood cells, and red blood cells tend to last for about 3 to 4 months. In its simplest conceptualization, the test is like taking your finger and dipping it in a glass of sweetened tea. If you take it out and taste it, it's going to be slightly sweet. Whereas if you take your finger and you stick in a jar of molasses, you'll probably pick up the whole jar or at least have a huge glob of molasses on your finger. Similarly to that, if your red blood cells are floating around in sweetened tea, they have a thin coating of sugar, and if they're floating around in molasses, they have a huge glob of sugar. I like to take this analogy a little bit further because diabetes is fundamentally a disease of the smallest vessels in the body. Areas that are most affected by diabetes are places that are a long way away from the pump, such as your feet, which have a low pressure gradient, your kidneys, which are filters and have a high percentage of extremely small blood vessels in them, and your retina, which are extremely metabolically active tissue. The retina wants to get as much energy as it possibly can per unit time because it's using so much energy to see. When the blood is flowing through the smallest vessels, like sweetened tea, just like you can suck it through your straw easily, it can flow easily and deliver nutrients to the tissues. Those nutrients can prevent infections and provide oxygen and other factors which are required for survival. They can also flush away toxins that are produced from cells and take them to the liver and kidneys to be removed from the blood. However, if the blood has a high sugar content and is closer to molasses, it does not flow through the smallest vessels easily, just like you cannot suck molasses through a straw easily. And the tissues have a hard time fighting infection or obtaining nutrients. Again, the feet and the kidneys are frequent targets of diabetic changes. The retina, which I'm particularly interested in, is also. When the retina does not receive enough nutrients because the blood is flowing through like molasses, it attempts to modify the vessels that are there or build new vessels. Unfortunately, it doesn't do a very good job of this. When the retina attempts to build new vessels or modify the ones that are there, it's a bit like having a group of plumbers to your house at midnight who have shared a 12-pack. Just like with drunk plumbers in your house at midnight, you're going to end up with wet carpets. The same thing happens with the retina. When the body attempts to modify and build new vessels, they tend to be leaky, they tend to bleed, they tend to cause wet retina, basically. Wet retina, unfortunately, reduces your vision and can lead to permanent and irreversible vision loss. Hemoglobin A1C levels are directly related to the risk of developing diabetic eye disease, kidney disease, and other complications from diabetes. It appears that a hemoglobin A1C at or below approximately 7 does not substantially increase most patients' risk of diabetic retinopathy, kidney disease, and other complications. Unfortunately, the risk goes up exponentially above 7. It more than doubles between 7 and 8, and again between 8 and 9. It's a logarithmic scale, so the curve essentially is drawn like this. What that means is that at high enough hemoglobin A1C levels, essentially 100% of patients will ultimately develop complications from their diabetes. Maintaining a healthy blood sugar level and an appropriate hemoglobin A1C is absolutely critical for reducing your diabetic risk. And periodic monitoring by ophthalmologists and other specialists is important to identify complications and problems at their earliest stages when they're still relatively easy to treat, rather than waiting until they've gotten out of hand and are much more difficult or impossible to treat.